Lindsay Overstreet was the team lead over this whole situation, and her major issue was the accuracy of the data and being able to reinforce the training or understand if they were actually hitting their key performance indicators. So one of the things that when I was talking to Lindsay, she actually took me out into the kitchen and she walked me through the process that Beverly just articulated, but she said, watch. The ambassadors are supposed to take that document after they've first recorded it and said they've taken ownership of it, walk over and actually fax that back to customer service. And she goes, watch, they won't do it, even though we're standing here. And sure enough, the ambassador filled out the time and walked directly out of the kitchen without following the steps. So Lindsay's confidence in the process was completely ruined, knowing that the process wasn't being followed and knowing that some of that information was being falsified as well. And she said the manual processes for tracking the trays was so burdensome and there were so many cumbersome steps that it promoted errors and, like I just said, falsification of data. And then on top of that, trying to tabulate if the data was correct and figuring out if their key performance were actually right, actually mandated them, the hospital, using overtime to calculate all of that information, and ended up being, it would continually be days behind, if not weeks behind. So it made basically the opportunity of training individuals almost impossible. They had no idea of were they doing the information or the steps appropriately or not. But Lindsay basically said that through the implementation of trays at document.com, all of that data is now real time and it's tabulated automatically so that training can now be reinforced good behavior as opposed to disciplining bad. Basically, the result of implementing the trays solution gave her one view of the truth.